Okay. So I think in Taiwan, you probably can purchase any product or nicotine replacement product in Taiwan pharmacy. So today we're going to just show you what's the idea if you are already a pharmacist in a community pharmacy, and what you can do and what product you can recommend to help people to quit smoking. Okay, so the first case, just a customer just come in and ask you for your help to quit smoking. So this customer has been tried for so many times, but all failed. So what's the concept like when it's come to like quitting smoking? Okay, most of the people when they want to quit smoking, it takes like 4 or 5 attempts to quit smoking. 所以通常戒烟通常一般的人不是第一次、第二次就会成功，通常需要好几次，甚至5次、6次的这个可能他尝试5次、6次以后，最后他才能够成功。So most of people they don't stop smoking straight away. It takes 5 or 6 times try or attempt before they can quit smoking. So still, we have to ask the question. The first one, yeah, are they taking any other medication? Yeah, because some medication they are taking my interact with nicotine. Okay, and for some medication, after they stop smoking, they probably will increase the effect for certain medication. Okay, because nicotine or smoking is an enzyme inducer in liver. We will talk about that for the next slide. And we also will ask, are they pregnant or are they breastfeeding? Because nicotine is a contraindicate for pregnancy. So if a pregnant woman asks for any product, we wouldn't recommend them to try. Okay, they probably have to try something else, but we're not talking about that at the moment for this class. Okay, and also we normally will ask a very specific question. Do they smoke 10 cigarettes a day, more or less? So this question is to find out whether they are very high risk of or just want to determine how bad their smoke habit. So they use 10 cigarettes, yeah, but some product they probably use 15 cigarettes, and some product probably will ask the question like if they when they first wake up in the morning, if they within 30 minutes, if they start feeling the craving for cigarette, then they mean they are the high risk or high dose user. 所以这里有一个问题，就是我们 问这个说你一天抽多少支的香烟？有一些产品是用10支来作为分界，有一些产品是用15支。那有一些产品，它可能会说这个问题是说，他们起床30分钟内会不会想去抽第一根烟？如果会想的话，就是表示他们就是那种就是比较重的这个烟瘾，他们烟瘾比较重所以我们在选择产品上，可能我们会选择比较高剂量。Or are they any asthmatic or diabetes or any heart problem or they have any peptic ulcer or they have sore throat or inflammation in the mouth because nicotine can irritate your throat, so sometimes can aggravate the issue, the whole issue, the problem. Or have they just denture or any dental work? For example, 那个假牙如果他们有戴假牙，或者是戴这些有些人要做牙齿矫正，那可能我们就某一些产品就不能够比较不方便去推荐使用，例如说这个戒烟的这个尼古丁的口香糖。So if they have any denture or any dental work, with certain product we probably can't recommend, like chewing gum, nicotine chewing gum. Okay, so when it's come to nicotine replace therapy, we have to find out where is the patient in the following cycle. There's a 5 stages. When everyone trying to quit something, the first stage is called pre-contemplation. So in this stage, mean the patient is not ready to quit smoking, but they think about it. They're not ready. And the second stage is contemplation. So in this stage, the patient know they should quit. They know that smoking is bad, but they don't know how to do it. They're not sure how to do it. Okay. And the third stage is called preparation. So in this stage, the patient, maybe they already try to cut down the number for the cigarette. Okay. And the fourth stage is action. So the patient in this stage, they already start doing something. They maybe already cut down the number and is already ready for quit smoking. And the last stage is maintenance. Maintenance means the patient has totally quit, but there's a still chance to like relapse. So they probably after something when they have the feeling or the craving for smoking. So when we want to introduce any product, we have to find out which stage is this patient in. Then we can, if the patient is just in stage 1, in this stage, you probably don't need to focus on any product. You don't need to, because they're still not ready. So if patient is coming in this stage, you probably just have to tell them, okay, what is the risk for smoking and what caused the issue for if you smoking or if you are pregnant, what will happen for your baby. Okay, so in different stage we have different approach for nicotine therapy. Okay, nicotine replacement therapy is just an approach to help smoking. It can double up the chance for quick smoking. And we know the nicotine in the pregnancy category is D, which is not recommended. Okay. And also, nicotine is normally in the liver is metabolized by cytochrome P451A2. Yeah. 你们有没有which is called CYP1A2？你们有没有学过这个东西在学校里面？这个 cytochrome P450。
以前有学过。
Okay, so you know the category for those enzymes. They help for to metabolize the medication. And smoking cigarette actually is an enzyme inducer for CYP1A2. So when people are smoking, the CYP1A2 will increase or induce. So which means the medication you are taking, the dosage has to be a bit higher. Okay, the cytochrome P450 enzyme. So we know that this enzyme is responsible for most of the metabolism for medication. And there are more than like 50 enzymes. And only 6 of them metabolize 90% of medication. So you don't really need to know all the enzymes name, but there's 6 more important one because 90% of medication they are metabolized by those 6 enzymes. And from those 6, CYP3A4 and CYP2D6 are the most significant enzyme. And you know the 3A4, the CYP3A4, I would say nearly 50% of medication they go through 3A4. So if you know some medication they are CYP3A4 inhibitor, then we have to be very careful. 所以这个 CYP 这个 CYP 这个 P450 这个 enzyme 里面呢，有2个非常重要的，一个是 CYP3A4 跟另外一个 CYP2D6 所以如果我们知道有一些这些酵素是属于 CYP3A4 的抑制剂，那这个就是非常非常的重要不管是抑制剂或者是说它会或者是所谓的诱导剂这些，所以你要记得，你现在可能对于这个 enzyme 没有太大的感觉，但是你要记得 CYP3A4 这个东西一定要记得 CYP3A4 以后你们会常常看到这个 enzyme， 因为它代谢大概超过 50% 的药物都是经过 CYP3A4。 Okay. So are they taking any other medication when they smoke or trying to quit smoking? Okay, because antipsychotic, the medications such as chlorpromazine or haloperidol or clozapine or olanzapine, those medication, once patients quit smoking, those medication they can the effect can increase, so which means you have to reduce the dose for those medication. And the second one is like benzodiazepine, like alprazolam, diazepam, lorazepam or sartepam. So 这些benzodiazepine 的这一些药物 跟刚刚前面那些什么精神病药这些，如果当你的这个抽烟的量减少，或甚至你已经不抽烟的时候，这个时候你的这个药物的这个剂量，我们要这个剂量要下调，因为我们 because we know that nicotine is a enzyme inducer. So when people are they smoke, they need higher dose to get the same effect. And the third one is beta blocker, because smoking can increase your heartbeat, heart rate, and also your blood pressure. So once you stop smoking, which is good, but if you start taking beta blocker because you are smoking, and your blood pressure is come from your smoke. Once you stop smoking, then and you are taking beta blocker, which means the beta blocker effect will go a bit higher. And also insulin, we need to do dosage reduction. And also fluvoxamine which is an antidepressant drug. We have to reduce the dose as well. Okay, other question to ask, we have to, when people, they are smoking, for example, are they asthmatic? If people are asthmatic, smoking can irritate or aggravate the issue. And also the diabetes or any heart problem because nicotine or smoking that can cause the constriction for the blood vessel, especially for the heart. So that's why for people they are smoking, they have a higher chance to get heart attack, or they have peptic ulcer. The reason we asked if they have any peptic ulcer, because when people having the nicotine replace therapy, nicotine can irritate or induce more your gastric acid excretion, so that can aggravate your peptic ulcer. Okay, and the second one, sore throat or any inflammation in the mouth, because sore throat and any inflammation can be aggravated by if you are using any nicotine therapy product. 然后 then denture or dental work, we already talked about that. So when are we going to refer the patient? The first one is when patient they have angina issue and it's not stable. So if they have angina issue, we have to find out whether is it still okay. If not, if still having the episode or something, we try not to treat it. But if patient is already stable, probably it's okay. We can recommend something for them. Okay, or recent heart attack, which is not a good sign, or cardiac arrhythmia. So they have irregular heartbeat for the heart. So those patients, it's better we refer to the doctor. They probably can use the taking drug instead of using nicotine. Okay, there are so many products on the market, so many different brands, and Nicotec is the one of the famous brand. So from this product, you can see step 1, step 2, and step 3. Step 1 is higher dose, 21 milligram. Step 2 is 14 milligram. And step 3 is 7 milligram. So normally the idea is when people, they are heavy smoker, they started with higher dose. and then slowly we reduce to step 2, step 3, which is lower dose. Okay, so this different product is the gum. Okay, some product is not like a patches. Okay, the Nicobay, this one is a patches， 是一个贴片，所以贴片的话是贴在身上贴一整天。那有些人不喜欢贴片，那 some people don't like the patches, so we probably can recommend the gum, chewing gum. So chewing gum on the market normally they have 2 strengths. One is 2 milligram, the other one is 4 milligram. So highest strength is for heavy smoker. Lowest strength is for people they not that bad. Okay. And for chewing gum, normally you just chew the nicotine chewing gum in the mouth. And once you start chewing and just rest the chewing gum between the cheek and your gum, and then repeat that process. And each chewing gum you can use for up to half an hour, up to 30 minutes. 所以这个尼古丁的这个口香糖，它就是一般有高剂量跟低剂量啊，所以如果你确定它是属于这种重度的患者，可能我们就用这个高剂量，一天可能可以用每个小时用一次哦，最多了，就是所以一般用所以说他们每次感觉到有想要吸烟的时候，他们就嚼一个，然后一般嚼一嚼以后，就把那个口香糖呢，就把它停到就把它放到你的嘴巴跟你的那个那叫什么牙龈中间，然后那个时候你那个尼古丁的那个药效就会从那里直接吸收到人体，然后一个这个口香糖你可以使用到就是最多到半个小时，它就要换了哦，超过半个小时大概就里面大概已经没有什么效果了。
老师可以问一下，就是在咬的时候那个口香糖会有什么感觉吗？就是我怎么知道，就是我咬到什么程度可以休息？
你们都没有吃过哈？
不会吃过。
以前我们在我们以前那个有给我们吃过啊，吃下去的时候你的那个嘴巴会有刺的感觉。So when you chewing the gum, your mouth will feel the stinging. That's how you feel when you are using the nicotine chewing gum. 刺的感觉，然后那个刺的感觉如果越来越小，你就知道那个药效就是就是里面的药就可能越来越少了。
好，谢谢老师。
Okay. Okay, so there are other products on the market, like spray, okay, or we call inhaler, and the other one is like lozenge, just like a lolly. So you can see the lowly ones. You can see there's a 2 milligram and 1 milligram. So higher dose and lower dose. And for the inhaler is when people they tend to have the hand to mouth habit, you know. Some people they still feel like something between their finger. Okay, for those people, you probably instead of recommend the chewing gum or patches, maybe the inhaler would be another option for them. Okay. So for Nicobay, this brand, when you ask the patient, they're using 10 cigarettes or more. So we will start from step 1. So normally you start step 1 for about 1 or 2 months before they reduce to the step down to the step 2. So normally in step 2, maybe keep it about 1 or 2 weeks, 2 weeks, 2 weeks, then they can move to the next stage. It depends. Some people might have to stay in one stage a bit longer. Okay. But normally we keep it about 2 weeks. Okay. There's no 100% principle. So you have to work out how are you going to do it. But normally for the first stage, step 1, we make it about 2 months before they step down to the next step. 所以在这个尼古丁的产品的选择上，我们基本上它都是从第1步、第2步、第3步这样下来。那至于说在我们一般会建议在第step 1的时候我们把它大概控制在2个月然后2个月以后，等他已经习惯了这个贴片，而且也不会想要再去吸烟的时候那这个时候我们可以考虑它就可以移到第二个步骤step 2。那基本上可能2个礼拜，那2个礼拜后如果没有什么问题，我们就可以再把它移到 step 3。好，那如果今天这个病人他是每天抽10根烟以下，就是烟瘾比较小的话，我们就会建议就是直接从 step 2开始那 step 2开始我们也是一样维持在2个月左右，然后再到 step 3，然后 step 3我们也是尽量建议是就只有待2个礼拜除非他觉得需要，我们再延长一点记得他们的第一个这个 patch 基本上都是在2个月然后再下一个 step。而且每一家厂商厂牌他们都会有不一样的方式所以这个并不是有一个什么绝对的标准但是原则上大概每一家厂牌都是控制在第一个 step 都会维持在2个月左右，然后再开始下一个。在台湾我记得也有这个尼古丁的或者这种戒烟的门诊这个我是不知道做的怎么样，这可能待会你们如果有什么意见也可以跟我分享。
老师，我们的贴片好像有2个牌子的，就之前我查好像是有2个牌子，然后一个剂量就是跟老师刚刚讲的一样，然后一个还有是禁烟，它好像就是10 ml、20 ml、30 ml 的这样子，然后它好像是比较长效稳定。
哪一个牌子？它的名字？
禁烟，干净的禁，然后抽烟的烟。对，然后刚刚
对，
它是不同剂量的，
是不是？它也是尼古丁。
对。
OK，所以这个牌子是台湾的，是不是？
应该是因为那时候我查应该是有这样子，对。
Okay，所以你看每一家厂商他们的那个方法都不一样他们都喜欢强调用自己的方法，不过没有关系但是那个概念是一样的，你只要掌握住这个概念，每一个产品都可以按照你的想法去建议，其实 OK 的。
然后还有一个是克烟，克是克制的克嘛，
然
后烟是一样，对，然后那个剂量就跟刚刚老师讲的这个产品是一样的。
OK， 所以你可以考虑要做这个 topic
没有，只是因为之前有那个稍微整理一下
，OK，
笔记，对，
谢谢你的分享。Okay, so the next one here is the chewing gum as well. This one is Nickelback chewing gum. So you can see 2 milligram, 4 milligram. Okay. And this this brand, they also got what they call mini lozenge. Okay, it's a tiny lozenges， 就是小小的这种类似糖的啊，所以它的剂量，the dosage are a little bit different, like 1.54. So, but the concept is the same, a higher dose and lower dose. And for people, see, the criteria here are different too. When people smoke 20 or less, they use lower dose. And they smoke 20 or more, they use higher dose. Okay, this one is different brand. It's called nicotine. Nicotine is a different brand. So you can see the dosage are different. Step 1 is 25, step 2, 15, and steps 3 are 10 milligram. And for Nicobate brand, they want you to put the patch on for the whole day. But for nicotine, this brand, they want you to put it on and when you go to sleep, you take the patch off. OK， 所以每一家厂牌它的要求的那个方式都不一样啊。所以你们这个表格你们可以自己看啊，这个不是什么好像是考试一定要完全正确哦。刚刚已经说过，我们以前说过了，这个安全是最重要的啊，不是我们并不需要说一定要局限在说哦，这个标准答案是几个星期哦，不需要。OK， so Nicorette， this brand, step 1, 25, step 2, step 3. And some other approach, you can use patches together with lozenge or patches with chewing gum. Okay, just for the whole day, you use the patch, but in between, if you still feel you'd like to have something, you feel the craving, then you can have chewing gum or the lozenge. So, okay, there's another brand. They have the product which is patch with nasal, so the spray. Okay. Okay, for nicotine patches is not suitable for occasional smoker. So if the patient is not, they don't smoke like every day. They just smoke when they feel like it or when someone they give them a cigarette. For those people, you probably don't need to recommend patch because once you put the patch on, the nicotine will stay in the body for the whole day. So for the occasional smoker, you don't. It's not a good idea. And if people they tend to have because it's nicotine. If you put the patch on during the night, some people might have the bad dream. 所以有些人可能在晚上，因为尼古丁它会穿透我们的那个 BBB 哈，那个血脑障壁，所以有时候会引起人会让人去做噩梦。所以这种情况，如果病人有这种问题，你就跟他说把那个贴片晚上把它拿掉啊，这样就可以了。所以我们刚刚看到有一家厂牌那个Nicorette 这个牌子，它为什么建议你？它是说白天睡前使用，然后到睡觉的时候把它4片拿掉。我想也是有它的理由的。OK，有没有什么问题？